we're taking your biggest coronavirus questions right to the experts. And tonight we're joined by Dr. Sharon Wright with Beth Israel Deaconess Medical Center. Dr. Wright, thanks for being with us today.
Thank you.
So a study out of South Korea is adding to the debate about sending kids back to school this fall. The study, apparently nearly 65,000 people took part, found that those between the ages of 10 and 19 can spread the virus just as much as adults. So how is this different, if it is different, from what had been believed about young people and COVID-19?
Well, that group definitely had the highest amount of transmission noted, around 18%, but even the group of household contacts, especially children with the lowest transmission, was still higher than with any non-household contact. So I think it shows that kids can transmit, and that's something that we've been learning throughout this. Also, they looked at the primary cases as only being symptomatic, so we don't yet know the role that asymptomatic transmission has in these groups, and it may be that younger children are just as efficient as as older children.
And this study apparently involves 65,000 people. Sounds to me like an awfully big group, but how much weight should be given to something like that, especially as we look to plan for the fall?
I think so far this study has been the most well done and systematic of all studies, and it's certainly the largest number of patients that we have seen so far. In some sense, it's not that different than influenza, where we see the greatest impact of household contacts, and often children get infected before parents. This is something that we need to watch. I'm not sure, again, that the age group matters as much, and we need to look at that asymptomatic transmission component.
All right, let's switch to testing now. Pool or batch testing is something new that we're starting to hear about. And Quest Diagnostics was just given emergency FDA approval to process COVID-19 tests using this pool method. So can you tell us, what is it, and are there advantages or disadvantages that come with it?
Sure. So pooled testing or batch testing means that they take the specimens from several patients, in this case 4 patients, together and combine them. And then they look to see if that pool or group of specimens test positive. And so if there is a positive result, that means that at least one individual specimen in that group is positive, and then they need to go back and test each one individually. The advantage of this is really in populations where you don't expect there to be that much COVID-19 in this case, because in a low prevalence setting, it'll really speed up the test results by being able to run them together, because you're expecting more negatives. And so if you have 4 negatives together, then you don't have to repeat anything. In situations where you have a lot of positives, such as what would have happened in Massachusetts during the surge, you're doing a lot of repeating, and that slows it down. The speed is really the advantage here, and also it saves on media. So when there were shortages of media or test kits early on, you wouldn't need as much media to run all of these. So it really depends on the prevalence that you're seeing, and it speeds up the test.
And is that something that could be used maybe in the Northeast, where we seem to, at least for now, be past the surge?
It's probably okay for now. I mean, this is an emergency use authorization. There are some questions that have been raised as to whether combining all of these samples dilutes the result, though Quest has passed the validation. It has not shown this. I think we have to see how this performs over time.
All right, Dr. Sharon Wright with Beth Israel Deaconess Medical Center. Dr. Wright, thanks for your time.